Hello and welcome to the Dr. Jaime Show audio experience. Today I am blessed to be with an amazing man sitting right next to me, Dr. Cesar Lara. He is with the age and weight management practice right here in the Tampa Bay area. You are a wealth of knowledge. I am so glad that you are with me. We just had a 1-hour show, the Dr. Jaime Show, which will be on iTunes and YouTube. But we are going to do a quick 4 or 5 minute rundown for you on a little bit about what we learned during the Dr. Jaime Show from Dr. Cesar Lara. Okay, so you have this practice on weight management. I can't say the word anti-aging. What is a weight management practice and what do you do?
So the reason that I don't like you to say the anti-aging is because I think aging is a gift that we all have.
Yes.
And we
denied to many.
Denied to many. And we would all like to age. The issue is we want to age gracefully, and the word that I like to use is age youthfully. Okay? So I personally would like to be 105 at some point in my life, but I would like to be able to be 105 and climb mountains, be able to ride bikes, be able to affect other people in a positive way, and of course be able to have intimacy with my wife and be able to enjoy all the fruits that come with being alive.
I love it.
For me, it's really age management and not something that is anti-aging.
Okay, so during the show, I would say one of the hottest parts of the show, we talked about hormones. There are 3 hormones: testosterone, progesterone, and estrogen. In a quick nutshell, what the heck are these?
So testosterone is the primary hormone that really gives us our sense of optimism, gives us our sense of energy, is directly related to being able to help us build and maintain muscle. It helps us be able to build and maintain our bone health. Both in males and females, is responsible for giving and supporting our sexual energy. So without adequate amounts of testosterone, males have a difficult time getting erections, maintaining erections, or more importantly, even feeling the urge to want to express themselves in that way. For females, it's exactly the same thing. Without adequate amounts of testosterone, their abilities to be able to reach a climax or have an orgasm begins to be less and less, but more importantly, they begin to feel less and less like they want to experience that. So
testosterone is both men and women, both in men and women.
The only difference is that in females, they probably use 1/20th in terms of the amount that males do, while males, being the fact that they're of their orientation, they tend to require 20 times a lot more testosterone than females do. So it's just a question of how much, but both are vital for optimal health. Okay,
very good. So the next hormone we talked about was progesterone. What is this?
So progesterone is really, for females, is really 2 hormones that are being produced at the level of the ovaries, and that's progesterone and estrogen. The progesterone is really crucial as a woman begins to go through the change in life, which is called perimenopause. The first things that begin to happen is she begins to feel like she's more forgetful, her sleep begins to become more disrupted, she begins to feel more tired, she begins to begin to feel more emotionally triggered by easy things, so she begins to be more reactive to her children, to her husband, to her co-workers, to her community. She begins to not like herself, and all of those symptoms are literally due to the subsequences of the progesterone dropping. In addition to that, many times she begins to feel a sense of tenderness in her breast, because the progesterone is what balances the estrogen, which also helps protect a woman against breast cancer. So estrogen is a critical hormone that helps a woman not only become emotionally optimized, meaning she feels more relaxed, more optimal, but more importantly, it also helps her with bone health, and in addition to that, helps stabilize and prevent risk factors associated with breast cancer.
And that's the progesterone that does that, or the estrogen?
The progesterone is the one that does that. The estrogen is actually the critical hormone for both males and females. It is also very effective in being able to improve their sexual energy. But in addition to that, estrogen is what gives direct health to your skin. So normally when a woman goes through the menopause, she begins to have a lot more wrinkles. She begins to have a lot more dryness in the vaginal area. She begins to gain more belly fat. She begins to feel more blah, for lack of a better word, that is all related to estrogen. Estrogen is basically feeds every cell in the body, and every cell in the body needs that in order to have optimal energy. It's not uncommon for a woman as they go through the menopause to suddenly begin to gain significant amounts of more weight, weight in areas that they never used to gain it before, and that's all related to estrogen deficiencies in addition to the testosterone. So all of these work in harmony together. The answer to being able to balance a woman is not by just giving her one, by understanding what she's deficient in and then begin to adjust them accordingly to be able to give her an optimal experience.
Okay, so at what point, real quick, because I know we're hitting that 5-minute time right now, but at what age should a man or woman come to you, and what do you do then, in a quick nutshell?
In a quick nutshell, typically 40 years of age and up. I mean, rarely we see a 38 or a 39 person, but typically 40, 45 years of age is when males and females begin to feel it, some a little earlier than others. The other important part to recognize is this is not just about feeling better. Of course, that's a primary driving force because we don't feel good when we suddenly start producing hormones. But the other part of it is that when we start producing hormones, we then have a significant increase in heart disease, strokes, dementia like Alzheimer's, in addition to osteoporosis. We lose our muscle mass, we feel weaker, we get depression, we don't feel well. So the diseases that are typically associated with us getting older can literally be decreased in the risk factors or prevented totally by being able to be optimized with adequate levels of hormone replacement.
Okay, so we need hormones not only for our mental health, but for our physical health too. Awesome. You can help us replace those hormones when they leave our body and go take a journey somewhere else. You can help bring them back. I love it. Okay, we have Dr. Cesar Lara here. Where can we follow you, find you? What is your website?
drlaraweightloss.com.
Okay, drlaraweightloss.com. Please go to it, find out all the services that this man offers, everything about him. He is a wealth of knowledge. And of course, go to youtube.com, type in the name Jaime Kulaga, click that subscribe button for me, and if you would, subscribe to our iTunes channel. You are listening to the Dr. Jaime Show audio experience.